So in this series on understanding and correcting your lab markers, we are going to focus on thyroid regulation. Our thyroid, which sits right here in the neck, plays a very valuable role in our metabolism, our body temperature. It plays a role in our mood, our digestion, and it's something that really should be assessed for all patients. So when we're assessing the thyroid, it's very important to have a full picture of what's going on with the thyroid. So this would include looking at TSH, which stands for thyroid stimulating hormone. Often in the medical system, this is the only test that's being done. And typically when I'm looking at TSH, I do like the levels to be at 2 or less. Anything over that, it may suggest some abnormalities with thyroid. The other 2 markers that I like to look at are both T3 and T4 in their free form. Both of these markers should be in the upper half of the reference range. And additionally to this, I do like to look at thyroid autoantibodies. And basically what that stands for is the markers that are reflecting our immune system reaction to the thyroid. We don't want any elevations in these levels, and we do want a full picture of all of it to fully assess the thyroid in terms of what's happening with the metabolism. So when I'm looking at correcting the thyroid, there's a few things that we like to think about. When there's a slight increase in TSH, the first thing I like to do is remove gluten. I've actually seen a pretty strong correlation between gluten consumption and elevated TSH. If gluten being removed doesn't help, then I further like to remove other anti-nutrients from the diet. So these would include things like beans and to some extent nuts, depending on how sensitive the patient is. For most patients, however, just by limiting gluten, we can see a big change in the TSH. The second thing that we want to look at is exposure to halides. Any halide can displace each other. So the thyroid is really interesting because it is predominantly run or it is connected to iodine. And iodine has a -1 charge. Any other halide with a -1 charge, so these would include things like bromide, chlorine, fluoride, can come in and kick off the iodine and slow down the function of the thyroid. So I do really find that removing sources of chlorine and fluoride to be a very effective way to support the thyroid. So this would include filtering your water. I'm a big fan of using reverse osmosis filtration, which does take out all of the negative components in the water. It would take out not only the chlorine and the fluoride, but any other chemicals. If you live in a place where you have access to well water, this is a great way as well. And then the other way that we are exposed to these chemicals is through our bath water, our shower water, and our dental care. So if you are able to put any filtration through your bath or shower water, and then aiming for a toothpaste that does not have fluoride in it, and also opting to not expose yourself to fluoride at the dentist. The other thing we want to do is increase minerals. So there's specific minerals that can help the thyroid: selenium, iodine, copper, zinc. All of these minerals play a very valuable role in thyroid function. And food sources that are very high in these foods include liver and also seafood. So things like oysters and mussels, which have more amount of iodine and selenium. So there's a few other ways that we can support the thyroid. One that I've seen to make a really big impact in my patients is using some form of hot-cold therapy. This can be done by doing contrast showers. So essentially you would have a shower, save a few minutes at the end where you do about a minute of very hot and then about 20 or 30 seconds of very cold, and then go through a few cycles, so 2 or 3 cycles of this. Hot causes a dilation of the blood vessels and cold causes a constriction. So we get this pumping action, which really stimulates the metabolism. And I found that patients that do this consistently do get a stimulatory effect from their metabolism, and they have seen a positive effect on their thyroid. Another way to do this is with a sauna and using a cold plunge or a cold shower, but typically contrast showers are more accessible to most people. Another way that we can look at the thyroid, I have found with a lot of patients that have a lot of cortisol dysregulation, sleep issues, emotional stress, this can actually shut down the function of the thyroid. So we want to make sure that we remove those sources. And then additionally, 2 other important things to think about. One is actually the stagnation of energy that happens through the thyroid when we have difficulty expressing our emotions. I have seen a connection with patients who have gone through difficult emotional situations or have difficulty talking about them, and we can actually get a shutdown energetically of the thyroid. So having a good way to output our emotions does help to support the thyroid. And lastly, using something like red light therapy. I actually had a patient who used it consistently 10 minutes a day for 3 months and made no other changes and saw a significant drop in her TSH, which was very interesting. So I have recommended red light therapy, and I do find a change with that.